Vitamin B12. All right, vitamin B12 belongs to the family of cobalamins and serves as a cofactor for two important reactions in human beings. As methylcobalamin, it is a cofactor for methionine synthetase in the conversion of homocysteine to methionine, and as adenosylcobalamin for the conversion of methylmalonyl coenzyme A, CoA, to succinyl CoA. So, vitamin B12 is a very important vitamin. These enzymatic steps are critical for annealing Okazaki fragments during DNA synthesis, particularly in erythroid progenitor cells. Vitamin B12 comes from the diet and is present in all foods of animal origin. The daily absorption of vitamin B12 is 5 micrograms. After being ingested, vitamin B12 is bound to intrinsic factor, a protein secreted by gastric parietal cells in an acid environment. Other cobalamin binding proteins called R factors compete with intrinsic factor for vitamin B12. So, vitamin B12 bound to R factors cannot be absorbed. Okay, that's very important to remember. Vitamin B12 intrinsic factor complex travels through the intestine and is absorbed in the terminal ileum by cells with the specific receptors for the complex. It is then transported through plasma and stored in the liver. So, you see the transportation of this vitamin. 3 plasma transport proteins have been identified. Transcobalamins 1 and 3, differing only in carbohydrate structure, are secreted by white blood cells. Although approximately 90% of plasma vitamin B12 circulates bound to transcobalamins 1 and 3, only transcobalamin 2 is capable of transporting vitamin B12 into cells. Now, liver contains 2 to 5 milligrams of stored vitamin B12. Since daily utilization is 3 to 5 micrograms, the body usually has sufficient stores of vitamin B12 so that it takes more than 3 years for vitamin B12 deficiency to occur if all intake or absorption immediately ceases. So remember that just because you stop taking vitamin B12, you're not going to develop symptoms next month because this is stored in your liver. Since vitamin B12 is present in foods of animal origin, dietary vitamin B12 deficiency is rare but is seen in vegans, like people who take strict vegetarians who avoid all dairy products, meat and fish. Then pernicious anemia is an autoimmune illness whereby autoantibodies destroy gastric parietal cells that produce intrinsic factor and cause atrophic gastritis or bind to and neutralize intrinsic factor or both. So, diseases that affect stomach can affect vitamin B12 absorption. Also, abdominal surgery may lead to vitamin B12 deficiency in several ways. Gastrectomy, like removing your stomach, will eliminate the site of intrinsic factor production. And also blind loop syndrome. This blind loop syndrome can cause bacterial overgrowth, and the bacteria may compete for vitamin B12 in the lumen of the intestine. And also because vitamin B12 intrinsic factor complex is absorbed in ileum, any disease, all right, in the ileum, or even when there is a resection of the ileum, this will eliminate the site of vitamin B12 absorption. Also, some medications cause problem. Metformin can cause vitamin B12 deficiency. Rare causes of vitamin B12 deficiency include fish tapeworm, Diphyllobothrium latum, because this fish tapeworm, it basically eats away all your vitamin B12 and your body doesn't get it. Also, pancreatic insufficiency with failure to inactivate compelling cobalamin binding R factors. You see, R factors bind to vitamin B12 and that is not absorbed. Severe Crohn's disease causes sufficient destruction of the ileum to impair vitamin B12 absorption, and also prolonged use of proton pump inhibitors. So there are a lot of causes for developing vitamin B12 deficiency, and it gives to many symptoms and signs. Vitamin B12 deficiency causes a moderate to severe anemia of slow onset. Patients may have few symptoms relative to the degree of anemia. In advanced cases, when the vitamin level falls below like 100 pg per ml, the anemia may be severe with hematocrit as low as 10 to 15% and may be accompanied by leukopenia and thrombocytopenia. The deficiency also produces changes in mucosal cells leading to glossitis as well as other vague GI disturbances such as anorexia and diarrhea. Vitamin B12 deficiency also leads to a complex neurologic syndrome. Peripheral nerves can be affected. All right. When people have the peripheral nerve disease, they complain of loss of vibration, loss of sensations. And as the posterior columns of the spinal cord become impaired, people complain difficulty of balancing. They say, I can't balance myself. I cannot walk. I can't feel my feet. All right, folks. So these things can happen from vitamin B12 deficiency. In advanced cases, even the brain will be affected. And people develop dementia, memory problems, neuropsychiatric abnormalities like psychosis can happen. So you see the range of symptoms that can happen. Also remember that just because there is no anemia doesn't mean there won't be any neurological problems. Okay, non-hematologic manifestations can happen even with a completely normal blood count. Patients are usually pale and they may be mildly icteric or shallow. But as the disease progresses, neurologic examination may reveal decreased vibration and position sense, or even memory problems, or even psychiatric problems like depression, anxiety, like that. So you need to do some labs. Okay. The diagnosis of vitamin B12 deficiency is made by finding a low serum vitamin B12 cobalamin level. So you can order a vitamin B12 level. Okay, whereas the normal vitamin B12 level is greater than 300 pg per ml. Many times, most patients with overt vitamin B12 deficiency have serum levels less than 200, but in severe cases, it can go even below 100 pg per ml, with symptomatic patients often having less than 100 pg per ml. You are seeing a very severe deficiency. The diagnosis of vitamin B12 deficiency in low or low normal values like from 200 to 300 pg per ml is best confirmed by finding an elevated level of serum methylmalonic acid or homocysteine. Okay, those values will go up. Serum methylmalonic acid or homocysteine. So elevated levels of serum methylmalonic acid also can be due to kidney disease. Okay, if there is kidney disease, you need to interpret that carefully. The anemia of vitamin B12 deficiency is typically moderate to severe with the MCV quite elevated. So the mean corpuscular volume goes up. Patients can have vitamin B12 deficiency with a normal MCV from coexistent thalassemia or iron deficiency in other cases. So the reason is obscure. So you can have vitamin B12 deficiency even with microcytic anemia. Okay, so that's important. Patients with neurological symptoms and signs that suggest possible vitamin B12 deficiency should be evaluated for that deficiency despite a normal MCV or the absence of anemia. So when you look at anemia, when you take that peripheral blood smear, you see megaloblastic anemia. That means like red blood cells, they appear as macrovalvulocytes. Okay, their shape changes sometimes, and neutrophils are hypersegmented. That's like they have many lobes. All right, they have many lobes, and mean neutrophil lobe counts greater than 4. So usually you will see megaloblastic anemia. The reticulocyte count is reduced because vitamin B12 deficiency can affect all hematopoietic cell lines. The WBC count and the platelet counts are reduced in severe cases. So vitamin B12 has so many presentations, and those are the most important things I gave to you. Next time I will talk about how to treat vitamin B12 deficiency. Visit our channel www.drpaul.org, and if you need treatment, please stop by my clinic. I would be happy to do a blood test on you, check your vitamin B12. I would be happy to give you B12 injections or tablets also. Please stop by my office. Thank you so much. God bless you. I will see you in the next episode.